Moving now to Chippewa County, the Human Services Department is seeing costs increase as the need increases for mental health services.
Felicity Bosk is in the studio to explain where this money goes and why it's needed.
In 2020, Chippewa County spent almost $1 million on IMD expenses, more than ever before. IMD stands for Institution for Mental Disease. Someone is placed at an IMD when they're in a mental health crisis and are a danger to themselves or others. But an IMD is not the first choice for Chippewa County residents in need of help. Tom Deal, manager of Chippewa County's Recovery and Wellness Consortium, says when someone is in a position where they are involuntarily receiving mental health treatment, they go to a local hospital for a few days at the very most. If the hospital recommends they continue receiving care, the county's crisis team then looks for somewhere that the person can receive the help they need. If the crisis team cannot find any hospitals that will take the person for more than those first few days, they are typically sent to Winnebago Mental Institute in Oshkosh. Deal says in 2020, their IMD expenses went up because more people were sent there as hospital beds were less due to the pandemic. But as for costs rising, they are running into an issue where people are sometimes being kept at Winnebago for weeks longer than in years past, a choice Deal doesn't always agree with.
We don't place people just because it's easier for us to do the service. We only are placing individuals that are at risk of safety to themselves and others. And we do review those cases periodically to make sure that we're providing the treatment services in the least restrictive setting possible.
Even as costs rose sharply with the pandemic, Deal does not anticipate they are going to go down dramatically now that hospitals are reopening, because he says more people are needing this institutional help, which is why he spoke last week with the Chippewa County Board to say they need additional funds to support people being placed in IMDs.
All right, that's Felicity Bosk reporting. Deal says the county does work with people to have them pay what they can for mental health services.